douching is bad. It's horrible. It's the worst thing that a woman can do to her vagina. And I want to say it clearly. It's bad. Why is it bad? Because generally the vagina, and this is something that we need to clear up. There's a difference between the vagina and the vulva. The vagina is a muscular canal that is inside the pelvis. Basically, for lack of a better term, it's inside your body. What we see on the outside is called the vulva. Okay, that contains the vaginal lips, the clitoris, etc. Now, the vagina, that muscular canal, basically, for lack of a better phrase, is like a self-cleaning oven. Okay, it has some bacteria that we call lactobacilli that produce acid. And these bacteria, they keep the vagina at a very acidic pH. Okay, they keep the vagina at a very acidic consistency. Now, what happens with douching? Whenever we douche, we change that pH. And as a result of that, the bacteria cannot function. Okay, a lot of the good bacteria in the vagina are eliminated by douching, and it gives rise to a proliferation or growth and overgrowth of the bad bacteria. Okay, so with douching, all of the feminine products, they advertise that they're going to maintain your vaginal pH. It's all a gimmick. Okay, they're going to change the vaginal pH over some time, and then you're going to develop a problem. The second thing is the applicators and so on for douching do nothing more than introduce germs into the vagina. Okay, whether you like it or not, you open the packet, it's sterile, but your hands have to touch it. Okay, perhaps on insertion it touches the vulva, the outer part of the vagina, for lack of a better term, and then you're introducing all of those germs into the vagina. The next thing is, right, the expulsion of that liquid material to douche is going to act as a vehicle which moves germs that are in the vagina through the cervical canal and up into the womb. And once these germs get into the womb, they could make their way further up to the fallopian tubes and create a problem, a medical condition that we call pelvic inflammatory disease. Now, this is a severe infection of the fallopian tubes, which could damage the fallopian tubes over time and cause the woman to become infertile. Okay, so it could really lead to infertility, right, among other problems. So to answer that question, douching is bad, douching is a no-no. No woman should engage in douching. Probiotics, whether they're good at maintaining some sort of vaginal health or not. There is very limited evidence that probiotics actually help with a woman's vaginal wellness. Okay, very limited evidence. There is some evidence that they do assist with digestive health, but there's very limited evidence that they do anything with vaginal health. Most of the studies that have purported to that probiotics help with vaginal health, they're very small studies. They're very limited studies, not a lot, and the numbers of persons who were used in the study is very small. So the data coming out of these studies cannot be used as solid data. So perhaps there is some benefit, but for now, we just don't have enough evidence to say, well, yes, we will actually support that idea.
So if a person is concerned about infection and about maintaining a healthy pH, for whatever reason, what should be their course of action then?
Their course of action is not to introduce anything into the vagina, that's one, and to maintain hygiene, typical hygiene of the vulva. Hygiene of the vulva the lady should attempt to wash the vulva twice daily. Okay, once with a very mild, unscented soap. Okay, She should not use scented soaps or scented feminine washes or anything like that. It should be an unscented soap or feminine wash. And the other time should be just with warm water.